Good afternoon and welcome to today's event, an introduction to healthcare careers. We are so excited to have you here today to hear about 4 different career paths for working in healthcare, and then options for getting the education you need to pursue a career in healthcare. My name is Sharon Alexander, and I'm the Director of Workforce Initiatives at the Virginia Hospital and Healthcare Association. And I'm excited to introduce you to some of our folks working in our hospitals. I'm also joined by co-host Philmika Reed, who's the Director of Healthcare Workforce and Community Engagement for the Virginia Community College System, who will talk in a little bit about healthcare pathways available through VCCS. So real quickly, a rundown of today's event. I will then turn it over to our presenters to speak about their careers in nursing, phlebotomy, respiratory therapy, and medical coding. I will then pass it over to Philmika to introduce her colleague and speak more about the healthcare pathways. And then we'll provide you with a few resources that you can find more information on healthcare careers and jobs. So I will now turn it over to our first speaker for today, Cassidy Buddha, who will talk about her current role and foray into nursing. Cassidy?
Hi, everyone. My name is Cassidy Buddha. I'm a registered nurse with my Bachelor's in Science of Nursing. I work at Valley Health Winchester Medical Center in Winchester, Virginia, and I currently work on their orthopedics/4 Northeast surgical floor. A typical day at work for me begins at 6:45. Typically, I arrive to the unit. We begin morning huddle. Our charge nurse carries this through, making sure that we're familiar with every patient on the floor and the additional needs that they may have. I receive bedside report from my night shift nurse who was taking care of my patients the shift before, and I begin my morning rounds. So morning rounds for me consists of assessing my patients, making sure they're doing okay, assessing their needs, making sure they have their morning medications, and reviewing their lab results. Everybody typically gets labs drawn in the morning. We assess, make sure they're doing okay, and alert our attending doctors if they need anything additional. Throughout the day, we're ensuring that our patients are receiving help with hygiene and bathroom needs, that they're eating a good breakfast, lunch, and dinner, making sure they have good appetite, especially in relation to their blood sugar and their nutrition requirements. On my floor specifically, I work in orthopedics, so my patients are here for new joint surgeries that limit their mobilization. So ensuring that they work with therapy and that they are able to ambulate throughout the day. We do a lot of turnover. Our patients only typically stay for about 24 to 72 hours. So we're doing a lot of admitting to the unit and discharging from the unit, as well as discharging to rehab facilities, nursing homes, just making sure we're doing that in a timely fashion. And we are reporting to those other facilities if they need some additional information. We're also preparing them for and to attend all procedures. So if they're going to surgery that day, if they are a dialysis patient or needing imaging like MRI, CT, ultrasound, just that they're getting that all done while they're with us. Throughout the day, we're updating our interdisciplinary team when patients' conditions change. So that would be our doctors, any additional consulting physicians, case management, respiratory therapy, occupational and physical therapy. Obviously, we are documenting. And if you're interested in nursing, we are doing a lot of charting throughout our day, specifically because you have a license to protect. You are a licensed healthcare professional. So your documentation directs right to your patient-centered care. So we want to make sure we're covering our butt while also making sure we're taking care of our people. And then towards the end of the day, night shift will come back around 7, and we're given bedside reports to our night shift nurses. The necessary skills to becoming a nurse, you want to make sure that you have your intelligence, obviously, your degree and your classes, they help prepare you for that. That's not only clinical skills, but also your time management, your ability to multitask, and your prioritization of the important things that are going on in your day. You want to make sure you have good communication skills, the confidence in your knowledge, especially when relaying to these interdisciplinary members. You want to make sure you're having good conversations that are directly pertaining to the patient, having emotional awareness and patience with your patients. it's hard to be in the hospital. You want to make sure you're doing the best you can to understand what they need from you in that moment. Physical endurance for sure. We work 12-hour days typically, at least that's what I do. It's difficult moving patients, helping them with mobility, and just you don't always have the time to, have your breaks exactly when you need them. So just making sure you can get through your day, and then level-headedness, making sound decisions, especially in emergency situations. I chose nursing because it was really important to me to have a job that helped and served my community, and helping others. It also provides job security, and there's always available nursing jobs. The versatility in your career paths is huge. You can take nursing anywhere geographically. You can go into different specialties, and definitely scheduling as well. If you have children or if you have other family members that you take care of, having a nursing job can really help to expand the way that you schedule yourself throughout the week. It also provides you with opportunities to teach. I thought maybe for a short period of time I wanted to be a teacher, but I ended up going into nursing because I had such an interest in the medical field. And I still feel like I'm able to teach my patients, teach their family members, teach nursing students that I precept, and also teach fellow coworkers about stuff they may not be as familiar with. My educational journey was very straightforward. I applied to a couple colleges in the fall semester of my senior year. I chose Temple University College of Public Health and received my Bachelor's of Science nursing degree in a 4-year program. I also was able to get my minor in public health while I was there. I was able to do some great clinical experiences at Temple University Hospital, Children's Hospital of Philadelphia, which is where I did my pediatric rotation, as well as Einstein Medical Center. And I went to college during the COVID pandemic, and we were still able to get a lot of exposure to the nursing specialties despite those limitations. I graduated in May of 2022. I've been at nursing for about 2 years, a little over 2 years now. And I sat for my NCLEX at the end of June, and I began my job at Valley Health the first week of July. The path to success for me started in 2019. I held a nursing externship position on an orthopedics floor in my hometown. There I was able to learn some really valuable skills, work directly under the nurses, and practice that interdisciplinary communication and all of those other skills we talked about. I relocated to Virginia from Pennsylvania after graduating college and applied to various positions at Valley Health and Ianova, with my top choice being the job that I am so lucky to have now, which is that day shift position as an orthopedic RN at Winchester Medical Center. In order to get that job, I sat for a virtual interview with my unit manager and my floor educator. They were able to ask me questions. I was able to understand a little bit more the flow of their unit. After that, once I began working, I had a 2 to 3 day general orientation at Valley Health covering just policies and procedures, and then a 10 to 12 week, I think mine was around 10 weeks of orientation to the floor with a preceptor who was so helpful to me. Some of the surprises, I will say for sure, is the length of orientation. I think when you hear about these jobs, especially in nursing, your typical expectations would be that you're on your own, that these experienced nurses eat their young and that you have the worst schedule ever. And that was not my experience at all. The 10 to 12 week orientation that I received with my preceptor was so helpful. She was the amount of refill that I had both between my unit manager, my floor director, our supervisor, my coworkers, the other members of the interdisciplinary team. They were just so great and welcoming, as well as scheduling flexibility. I fully thought I was working every holiday and night shift and swinging and doing, 4 shifts a week, 5 shifts a week, and that was not the case. I was able to schedule around important things in my life and was able to have some really great work-life balance. And I really just feel like the kindness and welcoming nature of my coworkers, I really hoped that would be what happened, but I was very lucky that that is what I received when I came upon the unit for the first time. And then lastly, I just wanted to end with a quote. The secret of getting ahead is getting started. I think when you're trying to figure out what you want to do with your life and what you want to do with your career, it can be very intimidating and daunting. But I will say that learning about the different paths and this opportunity to hear from all of these other great professionals is such an amazing way to get started and trying to figure it out. So I just really appreciate you guys listening to me and letting me be a part of this great event.
Great. Thank you so much for sharing, Cassidy. Next, we'll hear from Ben Benedict on his work as a certified phlebotomy technician.
Phlebotomy tech, also known as a phlebotomist, and I work at Lynchburg General Hospital. So what is phlebotomy? So everyone is probably familiar with it, but it's probably just not the name. Phlebotomy is a broad term, but it usually refers to the process of using a needle to access a vein for the purpose of blood collection. This process can also be referred to as venipuncture. The collection of blood is needed for many reasons, including diagnostic tests, monitoring drug treatments, and obtaining blood donations for transfusion. In the hospital setting, phlebotomists mostly draw blood for diagnostic tests needed to monitor patients' health, such as potassium, sodium, cholesterol, and the list goes on. So every day is different. However, the typical day starts off with choosing and stocking a computer on wheels. So we call them cows, which is a specialized cart that carries all the supplies we need. Throughout the shift, we are each given a section of the hospital to monitor, in which we monitor the patient charts to make sure all the blood work is properly collected. Nurses and doctors can put in orders to monitor certain aspects of the patient health. And lastly, phlebotomists are responsible for collecting the morning labs for each patient on what we call the morning run. I work night shift, so the morning run is at the end of our day, but day shift starts off with the morning run. During this, it is essential to be able to collect the morning labs in a timely fashion because of the quantity of patients we have in such a short amount of time. Usually we have about 20 to 30 patients in the last 3 hours of our shift. So this is the busiest part of our shift. However, the time really does fly. Phlebotomy requires a few skills in order to be proficient. Phlebotomists must have technical and tactile proficiency. We must master through experience venipuncture techniques, needle safety, and a delicate touch. Believe it or not, but the smallest changes in angle or position can rupture a vein and cause a failed attempt at a blood draw. Phlebotomists must be delicate and precise with where their needle is placed. We must also be able to keep attention to detail, such as patient identification and labeling the specimens. It's also very important to have good interpersonal skills, such as patient interaction, because it is a big aspect of the job. Education for phlebotomy is pretty straightforward. Certification and training can be done in an in-person training facility or online, and usually take 4 to 8 weeks, although some can be longer. Once the class is taken, you can get your certification through a certification exam. It's through a national certification company and is accepted in most states. Most hospitals also require new hires to undergo personal training by an active phlebotomist. This is to reacclimate new hires, monitor them, and train them on the software for our patient charts. So why did I pick this career? For me personally, I wanted to eventually become a physician's assistant. And for this, I must have a certain amount of experience in the healthcare field to get it accepted into a PA school. Phlebotomy has been a way for me to gain this experience through the quick certification, only taking 4 weeks, and I was able to become certified relatively quickly. There is also a high demand for phlebotomists. There's many jobs when I was applying, there's many job opportunities. And the direct interaction with the patients is also something I was really looking for in a job. I enjoy helping people and being able to hear the many stories and build relationships with my patients. It's been one of the most fulfilling parts of my job. The hospital has also been very flexible during my time at college, allowing me to schedule around my school schedule. The 2 things that surprised me the most about my job from when I first started is, 1, a lot more precision is needed than I originally thought. Some patients are extremely challenging to stick with veins that move or are very small and fragile. This is one of my favorite parts of the job, however, as it kind of keeps you on your toes. It takes a different approach for every patient. And the more experienced I've become, also the less painful that my sticks have become. I was also surprised by the vast range of patient responses to me. Some patients are great and very nice, but others are they're very rude in their attitude to blood work. But it's understandable because it's important to understand that patients go through a lot being in the condition they are in. and it's important not to take it personally. It's also essential to be able to educate patients on what's being tested. This helps ease the patient's mind and allow them to understand why they must have their blood drawn. So in conclusion, phlebotomy is a good career choice for those who enjoy helping people. It can also be used to gain medical experience and a foot in the door of the clinical setting. For those looking to be doctors, nurses, physicians, assistants, and other higher education opportunities, it's a great way to gain clinical hours needed for these pathways. Phlebotomy is a fulfilling job and an essential aspect of healthcare that is perfect for hardworking and caring individuals. I hope you will all consider phlebotomy, as it is a big need in hospitals today. Phlebotomy tech.
Wonderful. Thank you so much, Ben. The next area that we will hear from is respiratory therapy. And today we have Jennifer Glenn from VCU Health to tell us about respiratory therapy. Jennifer?
Good afternoon. Thank you for the opportunity. As Sharon said, I am the Director of Respiratory Care at VCU Health, but we also cover the Children's Hospital of Richmond, Torbrook Road, Tappahannock, and Sheltering Arms. Next slide. So what is a respiratory therapist? And so like nursing, we kind of specialize in two systems of the body, the cardiopulmonary system. And so we're trained with pulmonary medicine to work with people suffering from a pulmonary disease. We also range with managing patients in all stages of their life. So from neonatal, from birth, all the way to end of life care. You can be found at the bedside working with patients, transporting in helicopters, research labs, managing departments, and teaching. Next slide. Okay, a typical day in the life of a respiratory therapist. So VCU Health is a level 1 trauma center, and so there's a lot of emergency response to the emergency department, but as well as that, there's emergency response to rapid response team, and those are those patients that are out on the floor that may have had some decline in their respiratory status, and so they'll call the rapid response team to come to the bedside to manage the airway. Respiratory therapists, I like to consider us the subject matter experts on our airway and mechanical ventilation, our lungs. A lot of traumas come in to the emergency department, and so we're there with the first responders of the physicians and the nursing team, there again protecting the airway for those patients who can't protect it for themselves. We manage mechanical ventilation and artificial airway maintenance to patients in the intensive care unit, and so we're working with multidisciplinary teams to provide care at the bedside and making sure our patients are being weaned on a daily basis so we can liberate them from the ventilator. And so the whole goal is once you get that tube down your throat, we want to make sure that we get it out in a timely manner, and I'm sure that the patient really appreciates that as well. You can go to high-risk deliveries. And so if you're working in our neonatal intensive care unit, there's times where we're resuscitating infants that are born prematurely. So they're born early, some as early as 6 months. And their lungs aren't fully developed. So we're there managing that airway, making sure that they are brought into this world and we're able to help sustain life for them until they can get old enough to maintain their temperature and can feed and breathe on their own. We do have a transport team here where we do transport critically ill infants on the helicopter. We do ground transports as well, but those team members are trained to advance invasive procedures. And so I don't know if you've seen the little line, the blood lines that go in and out of the belly buttons. And so they place those, the UAC, UVC lines, they intubate, they do ART sticks, so sort of combining phlebotomy and nursing, and chest needle decompression if there's a lot of air in the chest and it needs to be evacuated. Our RTs also do ECMO management. And so ECMO stands for extracorporeal mechanical oxygenation. I apologize, I butchered that. But basically what it does is when the body can't oxygenate all your organs and needs help, it removes the body from the blood, oxygenates it through a machine, and then places it back in the body to then oxygenate all the organs. And so our RTs sit at the bedside and manage this for a patient. This is a life-sustaining piece of equipment. And typically these patients, there's some that are waiting for heart transplants or for their body to heal, but they're able to oxygenate the rest of their organs. And so we do the regular things that you would think a respiratory therapist do as well, which is what we call bronchial hygiene. So we deliver nebulizer treatments, chest physiotherapy to mobilize secretions so they can get the secretions out of the lungs, suctioning, and then breathing exercises. We do also have RTs that do pulmonary function testing. And so these are outpatient positions where you would come in and do breathing tests in a pulmonary function box. And so those respiratory therapists sit there and help them maybe get some diagnosis to help them with their continued breathing issues that's then sent to the pulmonologist. So really no day ever looks the same. It can be a surprise, and especially if it's a full moon and on a Friday night, anything can happen. All right. So why did I choose respiratory therapy? And I say the career chose me. I was going to go to physical therapy school, but they required 300 hours of observation. Respiratory only required 8 hours. So I went with a friend who was I was in anatomy with, and I didn't realize I loved it till I was in the mechanical ventilation stage, so the ICU phase, the intensive care unit. And that was 27 years ago. And so I do have a brother that has asthma, and I think subconsciously I might have chosen this career as well. But there is a wide range of opportunities from adult to outpatient diagnostic testing, bronchoscopies, neonatal pediatric care, industry, where you're doing pharmaceutical sales and device sales. And so there is a lot of opportunities. For education, you can go and get an associate's degree, which is 2 years, or go to a bachelor's program, which is 4 years. And so both of those would satisfy. But then you also, as part of the curriculum, you're doing clinical rotations with respiratory therapists at the bedside. Next slide. So my educational journey, I started out with my associate's degree. I just graduated high school, went straight into this program, and I was 19 when I graduated with my respiratory degree. I finished my bachelor's degree in allied health administration when I was 21. But let's be honest, nobody wants a 21-year-old running a department. And so really then focused on my career at that time and really learning. And so I was able to go travel. I lived in Hawaii, Colorado, and Utah as a respiratory therapist taking contracts. These are places that are short-staffed that need people to come in for 3 months at a time and help them with staffing. Came back to Nashville and took my first leadership role. And then when I moved here in 2017, I obtained my Master's of Science in Health Administration from VCU. And so you can see throughout the career, I've been a bedside therapist, which was very rewarding, from adults all the way to neonatal pediatrics. I served as a respiratory manager. I went into the pharmaceutical industry where I sold a synthetic surfactant, which is a drug that premature infants use, and then went into clinical research. So I had the opportunity to travel to Ireland, Hungary, Netherlands, and we were doing clinical research on premature infants in these places. So Canada, South America, those places. Then I came to VCU, Academic Medical Center, as the respiratory manager, and then once the director retired, I moved into this director position and have been here since. Next, is there a next slide? I will say, I didn't do this, but what surprised me most about this position is the wide range of opportunity. Like I said, you're not just where you come into it stuck at the bedside, and I hate to say stuck because some people really like enjoying interacting with their patients. But if you wanted to go into leadership, you can. If you wanted to go into clinical research, you can. If you wanted to do outpatient diagnostic testing, you can. If you wanted to go in infants and peds, you can. There's really a wide range of opportunities that this career can provide you. Thank you.
Wonderful. Thank you so much, Jennifer. And lastly, we will hear from Michelle on medical and surgical coding and the extremely important role that they play in healthcare. Michelle?
Yeah, thank you. Hi, everyone. My name's Michelle Boyd, and I work for the Children's Hospital of the King's Daughters, abbreviated CHKD. So I'm the medical surgical coding supervisor for 2 coding teams that work remotely from home. My credentials are that I'm a certified coder, I'm a certified medical records auditor, and I'm a certified coding instructor. The teams that my coders code for we code for primary pediatricians and pediatric specialists, specialties like general surgeons, trauma surgeons, plastic surgeons, urologists, neurosurgeons, orthopedic surgeons, cardiothoracic surgeons, dentists, and psychiatrists. So what does a medical surgical coder do? Well, as you can imagine, we read medical records, and a lot of them. So each coder probably reads over 100 records a day. And then we convert medical procedures and diagnoses into codes. So really, a medical coder needs to know two languages. We need to know medical terminology, and then we need to know medical codes. So for example, a tonsillectomy is the medical procedure you had. Well, that means removal of your tonsils, and the code for that is 42825. And then why you're having that tonsillectomy is the diagnosis. So you might have chronic tonsillitis. Tonsillitis means inflammation of the tonsils, and that chronic tonsillitis converts to code J3501. So then we take that information and we submit a claim to the patient's insurance company, and if we coded it correctly, it should be paid. So the end goal is to get paid correctly for the services that are documented and provided through proper coding. So why do we have to convert to codes? Why is that necessary? Well, it's an electronic world. We submit claims electronically, and then medical coding was needed. We required standardization of all the codes to report to the insurance companies. Codes are shorter than words. Codes allow for easier data tracking. So codes were needed to be able to run reports. I can run a report right now for a 42825 and how many one doctor had in the past year. That's why we need to convert to codes. But there are a lot of rules and guidelines that coders must follow to code properly. So we require the coders to have certain skills. So coders need to be certified first and foremost. So for example, I told you I was a certified coder. So I'm a CPC, I'm a CPCMA, and I'm also a CPCI. But my coders, many of them are CPEDCs. They're certified pediatric coders. And there's many different specialty credentials that are out there. We recognize certifications through AAPC, the American Academy of Professional Coders, as well as AHIMA, the American Health Information Management Association. Coders need to be well versed in anatomy and terminology. They need to know their coding guidelines, which are contained in their coding books. They have to be comfortable maneuvering through electronic medical records, various billing softwares. We still need to know how to type. We communicate electronically, so typing is a necessity. And then coders must be familiar with just the basics of using Excel spreadsheets. How I got into coding was I was always interested in the medical field. So I majored in psychology in college and loved those courses, but I wasn't interested in pursuing that clinical career. So after college, I started working for an insurance company, Blue Cross Blue Shield of Massachusetts. I was a claims processor, which means I was paying and denying those claims. And then I went into the provider relations department. So I was in contact with the doctor's offices and the hospitals who were trying to get their claims paid. So this is why I became interested in coding correctly. I saw so many claims coded incorrectly and was fixing those, which then led me to want to teach others how to code correctly. So a summary of my journey is I started out in high school. I graduated with a Bachelor of Science in Psychology. Throughout college, I became a certified nursing assistant to put myself through college. And then I started with Blue Cross Blue Shield of Massachusetts. I was with them for 10 years. I then moved to Virginia, where my husband is from, and got a job with a medical billing company, worked for them for 10 years. I then pursued my coding certifications, my CPC, my CPMA, my CPCI. And then I landed various positions with the Children's Hospital, the King's Daughters, in coding, auditing, instructing, and supervising. And I've been with them for 17 years. So I've got 37 years in billing, coding, auditing, and instructing. So you can tell I love it. I love this job. I've enjoyed every step of the way of it. So if you are interested in coding, CHKD is a great company to work for. And thanks for having me.
Wonderful. Thank you so much. At this point, I'm going to transition over to my colleague, Philmika, who will introduce our next and last speaker for today. Philmika?
Thank you, Sharon. Good afternoon, everyone. My name is Philmika, and I serve as the Director of Healthcare Workforce and Community Engagement with Virginia Community College Systems. My colleague, Dr. Angela Lawhorn, and I will be sharing briefly about Virginia Community College System healthcare program offerings, as well as some of our financial aid opportunities to assist students in paying for colleges. Next slide, please. Virginia Community College System, it consists of 23 community colleges across the state of Virginia. Our community colleges are 1 hour from each community, and we have satellite campuses throughout communities as well. Next slide, please. And why Virginia Community College? Virginia Community College System, once again, it consists of 23 community colleges across the Commonwealth of Virginia. We have flexibility in our course offerings to include offering classes online, hybrid, which individuals can attend in person and online, or the option for students to attend entirely on campus. Additionally, we have very low costs, which many times some of our students are able to attend college and obtain their degree having no college debt. We offer a wide variety of healthcare program offerings, including registered nurse as a 2-year program, our licensed practical nursing program, diagnostic medical sonography, surgical tech, phlebotomy, medical assistant, and many, many more. And next, I'll pass it on to my colleague, Dr. Angela Lawhorn.
Hi, good afternoon. Thank you, Philmika. So even though I'm Dr. Lawhorn, not a medical doctor, but I did start off my career in the military as a dietetic technician. So I worked in a hospital for many years before moving over to this realm. Real quickly, a lot of the certifications and credentials that we heard about today in Virginia's community colleges, we call those our FastForward programs. So those are industry recognized credentials, which could be a license or a certification, and you can earn those in a matter of weeks instead of years. And students can also stack credentials, and as you've seen a couple examples today, and it will increase skills, employability, and earning potential. And as Philmika added, we have in-person and online options for our programs. So this is an example of how one of our colleges, in this case, Northern Virginia Community College, was able to stack credentials, and students could complete credentials in a much faster pace. Anytime through the process, they could leave and go get a job, or they could keep going as they work towards their ultimate goal, and in some cases, registered nurse. So as we see here in the pathway, students start off as a certified nurse aide. That's the prerequisite to get into their FastForward practical nursing program. Now, as they move through, you can kind of see here in our graph that they have stackable credentials. So registered medication aide is next, certified phlebotomy technician is next, then certified clinical medical assistant as they work their way towards licensed practical nurse. Now, once they become an LPN, they can actually earn 16 credits towards the registered nurse program, which is an associate's degree program at our colleges. And so there are a lot of different pathways in allied health and healthcare. You can see a couple here that we have: emergency medical technician, pharmacy technician, medical coding. We've had some examples of that, but it even goes into diagnostic medical sonography, health information management, veterinary science, and then a couple new ones: respiratory therapy and biotechnology. So these are just some of the examples of healthcare pathways offered through Virginia's community colleges. So the big question is, well, how do you pay for all of these credentials and all of this training? So our FastForward programs can actually be started as soon as you're a senior in high school, and there is funding to help with that. So we have the Workforce Credentials Grant. So if you've lived in Virginia for at least a year, it can help cover 2/3 of your tuition. And then we have other funding such as Spantic and G3, which can help cover that first third. A lot of our students have their tuition covered, and there's no limit to how many credentials you can stack. So you can continue to apply for funding to cover these credentials. Now, our G3 funding is the new funding, and we just completed our 3rd year. Get a skill, get a job, get ahead. And we really have a strong focus on healthcare programs. That's one of the number one programs under G3. The intent is that you can earn stackable credentials, whether they're FastForward, or continue to a certificate or an associate's degree as you complete your program. So I really wanted to close my little presentation with the call to action. How do you get started with the Virginia Community College system and then find out more about funding? So we have FastForwardVA.org. That way you can learn more about stackable credentials and funding we have for FastForward programs. VirginiaG3.com. So you can also look at the credit programs that we have that build into associate's degrees and even transfer to our four-year partners. And of course, you can visit your local community college. Go to vccs.edu and we have a map that you can click on that will show you which college is closest to you. Thank you.
Wonderful. Lots and lots of great information. I just wanted to point out one last resource we put together to help you identify different avenues for entering the healthcare field from where you are in high school. You can visit our website, Onboard Virginia, to download this guide covering the different pathways and options and some links to more information about some of the resources that Dr. Lawhorn mentioned, including G3, FastForward credential programs, and healthcare degree programs talked about today. We also have information on there about different healthcare careers and a clickable map to find programs near you. You can also browse and research different jobs within Virginia's hospitals. We have a jobs page that pulls all of the posted jobs from our hospitals across the state into one searchable database. I encourage you to read and subscribe to our blog and newsletter, and you can keep receiving articles and information about working in healthcare. And don't forget to find us on social. That's Onboard Virginia.
Thank you again for taking the time out of your schedule to join us today. This presentation was offered in partnership with Virginia Hospitals and Healthcare Association and Virginia Community College Systems. We have attached additionally our contact information in the case that you have any additional questions about the programs that we discussed or the job offerings that we discussed. Feel free to reach out to us. Additionally, onboardvirginia.com is a great opportunity for learning more about healthcare opportunities that are currently available across the state of Virginia. Additionally, feel free to visit our website for G3 funding to learn more about the specifics of healthcare programs that are under G3 funding and to learn more about the qualifications. Also, our FastForward program offering, you can find more information via fastforwardvirginia.org, and you will have the opportunity to also submit your contact information if interested in a particular healthcare program, and someone at a community college will reach out to you. Again, thank you so much for your time, and we hope this has been helpful to you. Have a great afternoon.